Welcome to Voices of Care, the podcast series from Newcross Healthcare that seeks to get to the very heart of the issues facing the health and social care sector in the UK by really attacking the question of how we can enable the healthcare workforce of the future. I'm Suhail Mirza, and social care has never been more prominent in the news. According to some commentators, it's facing an existential crisis, and others are saying its workforce is at the worst point that it's ever been. It's vital, therefore, to hear from leaders with experience of how we can solve this challenge, and therefore I'm delighted and honoured to welcome Raina Summerson, the Group CEO at Agincare. Raina, thank you so much for travelling and joining us today in the studio.
Thank you for having me.
It's an absolute privilege, actually. I wanted to ask and get straight to the key question. I hate to remind you that you're over 30 years in the sector and seen so many changes. Jeremy Hunt chaired the Health and Social Care Select Committee in the summer. He's doing other things at the moment. And in that report, they claimed that the workforce crisis within the NHS and social care was the worst ever. We've seen huge numbers of shortages, 165,000 skills for care. How bad is it on the ground? Are you seeing this as a crisis, or perhaps that dwarfs all others?
Yeah, certainly. I think even since the Health and Social Care Select Committee, I think things have gone backwards, as indicated in the Skills for Care report. And I think certainly when you look at the kind of direct care delivery, it's never been as bad. So we have, as you know, Agincare has different service streams. So we have care homes, we have home care, we have live-in, a training company. We work with younger adults with learning disability and autism. So usually you see some flex and movement across those services. So if one is having a particular workforce challenge, maybe home care because of fuel prices or something, then people kind of gravitate to care homes more, where they work more as a team or they don't need a car, etc. And I think in the last year, it's certainly just hit all of the services. It doesn't, home care is certainly the hardest hit. And I think that is a lot to do with fuel prices, cost of living, less, younger people driving or being able to afford to own a car or wanting to own a car or having a driving test and delays in driving tests. So I think a multitude of reasons that have hit home care more, but certainly, absolutely, I know we use the word unprecedented a lot in social care, but really unprecedented staffing challenges, yeah.
The survey that Newcross Healthcare Commission YouGov to undertake, the care survey, only a few weeks ago, found that 27% of care workers were thinking that they were likely to leave the sector. So we've got an even more pressing challenge. There's been a fundamental watershed in the landscape of health and social care with the integrated care systems taking a statutory footing. Do you see even nascent hope that agenda of integration will help workforce across social care too, or is it still very much skewed towards the NHS?
I think it is invariably still very skewed to the NHS, but I do think there's glimmers of hope. And as I think I've been working fairly long term with the ICS, as it was in Dorset. And although that role and the workforce planning and the kind of boards and the subgroups have changed slightly since July and the ICBs, we're still being very much involved. And there's some really nice kind of cross-working being done on things like vocational scholarships, on apprenticeships, which is around using some of the resources coming into the NHS and into the ICS and filtering that through into social care. So I think there are glimmers of hope. I think ultimately, even with those glimmers of hope and where there's some really interesting projects going, the end game is ultimately always spoken of about helping the NHS. And the danger is if you do something within the ICS and the ICB that around workforce, that unless it's done really carefully, it's really just kind of pump priming and using social care as a funnel to supply the NHS with more skilled workers and seen as a kind of stepping stone. So it's not, or it's just about hospital discharges. It's not about what the truth of social care is, about prevention, about community, about building good social care that helps more in a more preventive way.
Well, let's focus on that a little bit. Tim Oliver, the chair of the County Councils Network, has been on record this month making a similar point, saying that there needs to be true local authority representation in the decision-making process of the ICS. And social care, as you say, the narrative is often as a conjunctive way of looking at the NHS. But I want to step back from that. You've been doing a lot of work with Social Care Future, and just want to talk about the advocacy. We talk about parity of esteem between social care and NHS. We have a long way to go, but can you just elaborate a little bit about social care in of itself and its contribution?
Yeah, I mean, you mentioned Social Care Future, and it's something I think, as a qualified social worker, I'm quite passionate about, the kind of roots and values of true, proper social care and what it should give, as you say, rather than just a kind of prop for NHS and hospitals and a kind of acute care, because it's about taking it back to so much earlier than that and kind of building healthy communities, healthy resources, so that hopefully people don't draw on the NHS as much because it's a different kind of lifestyle. So I think the Social Care Futures is a really interesting parallel to, in a way, our workforce issues, because it's about people with lived experience being more engaged and asked about and involved in decisions about social care. And it is about the roots of social care. It is about looking at what is good social care, like what is the place that we call home? Why is home? What does it mean to all of us? And not kind of othering people who, are often termed to be disabled or ill or vulnerable. And actually, that's us. That could be any of us at any given time. So it's about how do we build a system that helps us all? And I think the parallels for workforce are the same. How do we address some of the workforce challenges we've got, unless we find a way to really more positively promote social care and all it does, and to involve our workforce better? And that's incredibly hard to do really, really meaningfully with our direct care workforce, especially at times when it's so pressured and getting their time on anything but direct care is really difficult. So,
no, look, it's encouraging to see that work and the advocacy, as you say, of the contribution that social care stands alone in making, irrespective of the rest of the landscape. Before we go into some of the detail in terms of the solutions that you're seeing in helping the workforce, I have to use the F word, funding, of course. Jeremy Hunt, Chancellor now, delivered the autumn statement to many commentators, was far more generous in terms of provision, whether it was the Better Care Fund. Some things were delayed, social care charging to 2025. But you'll know, of course, when he was chair of the Health and Social Care Select Committee, which you were familiar with, he asked for £7 billion of funding. We're a long way short. Just how important is that right now? Because without proper funding, we are going to be facing a bit of a chasm between expectations and delivery.
Yeah, I mean, funding is always important. I think it's important in terms of accountability as a society. Where, what and how are we prepared to fund social care, because that illustrates how important we see it to our society and people that work in it, people that might need to draw on it. So I think it is incredibly different. You can't implement policy and you can't implement change without some funding being there. You can't reward the workforce to work in it and work in it well and be rewarded and recognised for that being a really important job if you're not funding it properly and you're trying to get away with people being paid a lower wage. So I think the funding is key, and it's not the be all and end all. And I think there's a lot, as you say, a lot of smoke and mirrors around in social care, and some of it is around, new policy and the changes and reform, when in reality, if the Care Act 2014 was enacted properly and funded properly, that would have made a lot of the changes that reform is kind of seeking now. And it's just not been successfully and fully implemented or funded. So yeah, you can't get away. Funding is invariably linked with the issues across the sector and some of the solutions. But equally, there's something about changing the narrative behind how we talk about social care, about how we as sector leaders, about how government understand it. There's a lot more to it.
Absolutely.
That is a key part.
We have to hope the advocacy continues. Going to the solutions, if I may, work that you're doing at Agincare, your wider experience, of course, with Homecare Association in the past, what you're seeing in the sector. We conducted the survey, Newcross Healthcare, and it found that 67% of people who were interested in care as a potential career didn't know how to actually enter the sector. So it goes back to the advocacy point, and I wanted to find out what you've seen in terms of promoting the sector in a proactive way, so that you're seeing some developments for people looking at the sector as a potential career.
Yeah, I mean, I think it's a really important point. And I think social media is obviously becoming more widely used, but it's keeping up with what maybe younger people coming in potential workforce, what are they using, what's important to them. So I think there's sometimes a disconnect between, providers and, what they're using to try and get information out there and attraction. I think there's something around, we do a lot of work with schools and colleges, and we get some moans and groans that can be, it's not productive, there's not the ROI on it, because they're kind of the wrong age group. But for me, it's incredibly important to get in at a younger age. To me, it should be part of our schooling, our education system. It's about awareness, again, of social care, what it offers as a career, what it offers society, the different routes, because it's so multifaceted and everyone, just lumps it into this kind of, thing that they don't quite understand. But, it's complex, so you need time to talk to people. But I think if you can get into schools, because I know when we worked with one of the local colleges on a kind of health and social care academy, and I found it was like educating tutors and lecturers and teachers and educating families, because they come onto a health and social care stream, and you've often got kind of people, they go into nursing, or they go into nursery nursing, childcare, or they go into social care. And I'm sorry, most families, given the media coverage on social care and all the negativity that surrounds it, you get your son or daughter coming home and saying, I don't know what stream to go. I say, shall I do childcare, nursing or social care? Probably 99% of families will go, don't do social care, it's awful, you'll end up in a care home and it's really bad. And go into nursing or go into childcare. So I think there's something about informing and advising families, society, people. It goes back to that broader narrative about social care. And we get stuck on this doom and gloom story, and funding, which is essential. But, we get stuck in this rut, and then and if we're talking about doom and gloom all the time, why would anyone want to come and work in it, really? So it's a bit counterintuitive when you kind of...
No, but as you say, the advocacy, you'll know the prediction, we need 490,000 more people over the coming decade. So making that advocacy with schools and colleges, and you're seeing some tangible results from that.
Yeah, it's slow. It is, apprenticeships, we've done really well. We've through, training now, we've delivered kind of, 300 plus apprenticeships. And they are not all entry level, they're kind of different levels, but really reflecting the careers that are available in social care and offering people a different way to come into the workforce. So, I think success, but it's slow in terms of the schools and colleges. You need the media on board, you need, education system on board.
Absolutely.
The government on board. It would help if someone understood social care.
Well, I think hopefully the series will allow us to elaborate and to hear from you and others to do that. I wanted to touch base, we've talked about attraction, which is really important. I know that the wellness and well-being of the workforce is very close to your heart. You've spoken publicly about it. Again, we go back to the Health and Social Care Select Committee a year ago now, saying that burnout was at an emergency level. The Newcross Healthcare Care Survey found that 38% of care workers had reported a deterioration in their mental health over the last 12 months, only 17% an improvement. Again, some specific, we know this is a challenge, it's across society. Cost of living, of course, financial well-being is inextricably linked to that. Anything that you're seeing and things that you're seeing which you're proactive around helping the workforce deal with the broader wellness issue, but also particularly the cost of living challenge?
Yeah, I think job satisfaction for people working in social care is an issue, because it's not just about what you can do as an employer. For us, most of our work is local authority or NHS. So, you've got high dependency levels. You've got people who maybe aren't getting the care that they need. Assessed wise, they're getting the minimum. So our workforce are having to go in there and, the people that draw on our services, they have to see them evidently needing more care and then go away and shut the door behind them and go off, and that's a heavy load to bear. So I think there's that whole wraparound piece for us. So I think there's something about learning and development, making sure people feel competent and confident in what they do, making sure they understand the bigger picture, so they understand their part in it. And I think that in terms of the cost of living and the kind of issues facing the social care workforce in the kind of last year, and just society generally, information, honesty, we do loads of kind of signposting, newsletters, comms, obviously things like blue like hard, and anything we can get into the organisation that can offer support or welfare, mental health first aiders. But you are kind of often like providing some, I don't know if you're not preventing it, you're kind of providing some options and solutions and support. And I think recognising this is what's going on in society, this is what we're trying to do in social care, this is what we're trying to do as an employer, but we recognise that sometimes that's going to fall short of being enough. And your point earlier, people saying they're leaving, I think, we've got more in our surveys, people saying, I love what I do, I believe in what I do, I believe I make a difference, but I don't think I can afford to stay in social care, and I don't think I would recommend anyone to come into it. And that's not a great reflection on the sector.
No, and I think that's part of the bigger picture, as you say, for advocacy, funding. And on the wellness point, just to touch upon it, obviously, I know you're, again, a big advocate, but there's been growing support for the idea that actually people can speak about mental health now in social care, and it's not something that they should shy away from.
Yeah, no, definitely. And we, as I said, we've done a lot of work around mental health first aiders, and I think people have really embraced it. And I think it's helped them in their personal lives as well as professionally. And it's kind of had a kind of cumulative effect. People go, I really enjoyed that. And actually I feel more empowered and I feel better able to support my team. And so kind of more and more people have done it, which is great. So, yeah.
Absolutely. Touching upon expanding the learning and development point, Newcross Healthcare has as part of its mission to be a learning partner for life for people in the care sector, providing training for free. You've touched upon some of the work that you do with training now, and it's at multiple levels across the place. So can you expand upon that? Because that's so important to be able to, it's not a stopgap, there's a real career pathway all the way to leadership.
Yeah, I mean, we did it on the back of apprenticeship levy and kind of feeling we were going to have to pay a tax anyway, and how could we act as a catalyst? Obviously, we had an internal training department anyway. We had, and then we used various people, and we still use external organisations, but primarily training now provides, all our short courses and our induction and apprenticeships at all different levels, and also provides really good welfare programmes for our international recruitment. And we haven't touched on that today, but obviously it is a something that's really developed quite strongly this calendar year for a lot of people, and I think post-Brexit. And we've invested a huge amount of time and effort into not just welfare when people arrive here, but trying to do that kind of before they arrive. And so I think that whole support, that blend between HR and support and training and the operations is really kind of melded into, and I think that's then influenced how we work with our other team members, because sometimes we look at, well, actually we're giving all this support and welfare to people coming from overseas, which isn't necessary and right, but actually how can that influence what we're doing for our existing workforce here? So yeah, the training now for me gives us control. It's an Ofsted. Getting into another regulatory area was like not a joy, I can say, but we've done it and they've got a good rating, which is a real achievement for the team in the current environment. So we're really excited about where that can go. And we're doing work again with the ICS, linking in our training company, not just from the operational care side, but our training company. So again, trying to get that whole population and solution approach, particularly in Dorset, because that's our kind of about a third of what we do is in Dorset, and our obviously support function offices there. But we'd love to do more of that across our other ICSs, but it's just getting those inroads, as you know.
No, but it helps. I mean, it's a traction piece, but it also helps with the longevity in terms of having that pathway. Yeah. We can touch upon international recruitment. It's something that you're very familiar with. It's not an easy thing to do, particularly in rural areas, etc. Have there been perhaps you've talked about the work that you've done this year, have there been 2 or 3 things that you've learned from that and your broad experience that makes that a possibility, that can really make that work well?
I think it's like most things in life, treat people as people, not as a commodity. And I think there's a danger that we start treating people as commodities. So I think, remember the person. It's a huge journey for people, an immense amount of skill and bravery and kind of passion and vision for a new life. So I think really get to understand that, and culturally that can be different from country to country. You've got to invest in it. You can't, there's not an easy option. It's expensive. There's time, there's a big resource, but you either want to do it and do it well, and then you hopefully will, get that reward, because there's some amazing people coming with amazing skills. or there isn't an easy fix. It's remembering the people, time and resource, and again money behind it. You've got to do it properly.
And promoting the social care sector, of course, internationally is part of the advocacy that you have to do.
Yeah.
I wanted to end with a broader picture. Obviously, Agincare is, I think, 35 years plus, a big employer in the local community. Just trying to marry that with the ICS intention of having a seamless approach to health and social care. Are you beginning to see perhaps that chance that there could be multidisciplinary teams that move back and forth, that we can have a region that actually promotes health and social care in one swoop, as well as being employers that are, the NHS is an anchor institution, but large organisations like Agincare are also anchor institutions for the local economy?
Yeah, I mean, it's anchor institutions is that's like a whole a whole episode in itself, because I talked to someone in the NHS about exactly that, and I think that is something that I think it deserves more time and thought. I think the health and social care combined approach, in our other ICSs, we are seeing those glimmers of people reaching out, and because we're a larger employer in other areas, not just Dorset as well. Yep. So, but in Dorset, I'd say definitely they're really trying to promote health and social care. And I think the scholarship project that was talking about earlier, that they're really going out to advertise, to use their money to talk about social care careers, and try not to make it just like a funnel that ends up with people going into social care and into NHS. That actually people know these are the jobs on equal, and we're trying to band it and show pay levels and career levels and job descriptions and things. So I think there is, and we're doing also a lot of work in our live-in care and across all of them in terms of multidisciplinary work.
Yep.
So our teams are spending more time in hospital sites, maybe doing more outreach work and hospital discharge work, and I think if you can share those same values and goals and your objectives are the same, then that's, and raising awareness of people's roles in the ICS, I think is so important, because, it's not just people don't understand social care. We don't always understand the different roles in the NHS. So definitely think there's hope, and I definitely think there is more going on and some really exciting stuff. But again, for a lot of providers, that takes time.
Yeah.
And actually it's quite a lot to give. So I think smaller providers struggle with that sometimes because they're in their organisation doing multiple roles. And, even for me and my team, when you've got, tens and tens of different organisations that you've got to work with, or ICS, trying to spread that and give it the time, because in Dorset it is there's a lot of time, but if we can crack it there, then hopefully there's kind of ready-made solutions to take elsewhere.
Well, I want to use a four-letter word now, which is hope, because
yes,
you've referred to it. We would like to focus on that. And this care survey that Newcross Healthcare commissioned you guys to do a few weeks ago, one of the interesting findings was that 80% of respondents said that they believed that social care was as valuable as the NHS, and 55% said they would be happy for taxes to be raised to pay for it. So maybe with advocacy from yourself and others, there is hope that the funding issue might be seen in a broader light than just pounds, shillings and pence.
Yeah, I think so. I mean, I felt that last year kind of through COVID, post-COVID, that I felt the public generally was better prepared to pay for social care, to look at it being, in something that they pay taxes towards in a clearer way, and I think there has been some raising of that awareness, and I think people, but I suppose it's those how many people experience social care and then understand the importance of it, and often because it's not promoted as well or talked about in the right way, it's not always understood enough. I think if people are touched by it, or they just learn a little bit, they go, absolutely, that value is there. We need that, and let's commit to it, and let's fund it better. But you've got to get the awareness up first, which is part of the challenge. But,
hope springs eternal.
Absolutely, yeah. There's hopeful sparks always, and I always say to our teams, all of these challenges we talk about, all this doom and gloom, but actually every day, how much amazing care is given. And some of it goes wrong because we're dealing with people and we're dealing with very personal situations. But actually, most of that goes right. And it's amazing what the difference that makes to people's lives every day. And beautiful relationships formed. It's not just one way. If you're working in social care, working with people who draw on your services, it's a reciprocal arrangement, and you learn from it as well. So
absolutely. On that note, I'd like to thank you, Raina Summerson, for your time, candour, and insights.
Thank you. Thank you for having me.
My pleasure. If you've enjoyed this episode of Voices of Care, please like, follow, or subscribe wherever you receive your podcasts. And if you want to receive information about how we are truly enabling the healthcare workforce of the future, please visit newcrosshealthcare.com/voices of care. I'm Suhail Mirza. Goodbye and thank you.